I'm Dr. Nnamdi, urologist. And today, I want to start with a truth that may unsettle you, but may also save you years of silent suffering. Most men do not wake up one morning with prostate disease. It develops slowly, quietly over time. Not because the body is weak, but because it is ignored. And one of the most ignored causes of prostate suffering is chronic dehydration. Men worry about cancer. They worry about surgery. They worry about sexual function. But they rarely worry about water, even though water is one of the most powerful protectors of the prostate. Before we go any further, let me say this clearly. If you are a man over 35, if you urinate frequently at night, if you feel pressure, burning, discomfort, or unexplained pelvic pain, this channel is for you. Subscribe now. Here we educate. We prevent. We restore dignity to men's health. Now let me tell you a story that changed the way one man looks at his own body. A patient named Chukwudi, a 52-year-old Nigerian man, walked into my office looking defeated. Not dramatic. Not panicked. Just tired. He had lived with prostate discomfort for almost 4 years. Night after night, he woke up to urinate. During the day, he felt pressure deep in his pelvis. Sometimes, the pain radiated to his lower back. He avoided long trips. He avoided sitting for too long. And slowly, he began to believe that this discomfort was simply the price of aging. "Doctor," he said to me, "I thought this was normal for men my age." That sentence broke my heart. Because suffering should never feel normal. When I reviewed his tests, something stood out. Yes, there was inflammation. Yes, there was congestion of the prostate. But there was no aggressive disease. So I asked him something no doctor had asked him before. "How much water do you drink every day?" He smiled awkwardly. He thought I was joking. 2 glasses of water. Sometimes 1. Mostly coffee. Mostly sodas. Often nothing until evening. Chukwudi was not sick because his prostate had failed him. His prostate was inflamed because it had been chronically deprived. Let me explain something every man must understand. The prostate is a gland that lives in a delicate environment. It surrounds the urethra. It depends on proper blood flow. It depends on oxygen. It depends on fluid movement to flush out waste and inflammatory byproducts. When you are dehydrated, your urine becomes concentrated, acidic, and irritating. Every time you urinate, that irritation passes directly through prostate tissue. Day after day. Year after year. Dehydration also thickens blood circulation, reducing oxygen delivery to the prostate. This creates congestion, and congestion creates pain. Water is not just hydration. Water is circulation. Water is detoxification. Water is inflammation control. With Chukwudi, we made a decision together. Before aggressive treatment, before heavy medication, we would restore the most basic biological foundation, hydration. I asked him to drink water intentionally. Not in excess. Not all at once. But steadily, consistently, from morning to evening. Clean water. Room temperature. Sipped, not rushed. Within 2 weeks, his urine flow improved. Within 1 month, his nighttime awakenings dropped from 4 times to once. By the 3rd month, his pelvic pain had softened, no longer sharp, no longer constant. He looked at me and said something I will never forget. "Doctor, I feel like my body remembered how to heal." And that is exactly what happened. Water does not cure everything. But without water, healing is impossible. Here is what science and clinical experience both confirm. Water helps flush bacteria and inflammatory toxins from the urinary tract. Water reduces prostatic congestion, allowing tissues to relax. Water improves lymphatic drainage, which is essential for reducing swelling. Water supports hormonal balance, which directly affects prostate growth. When men drink too little, the prostate becomes stiff, irritated, and overworked. When men hydrate properly, the prostate becomes calmer, softer, and better perfused. I tell my patients this. Your prostate is not your enemy. It is responding to how you treat your body. Many men wait for pain before they act. But prevention is quieter than disease. Drinking water daily, intentionally, is an act of self-respect. It is not weakness. It is wisdom. And let me be very clear, this is not about fear. This is about empowerment. You do not need to wait for surgery. You do not need to wait for medication. You do not need to wait for a diagnosis that frightens you. You can start today. Drink water when you wake up. Drink water between meals. Drink water before your body screams for it. Your prostate is listening. And if you are already experiencing discomfort, do not lose hope. I have seen men recover comfort, confidence, and control. Not through miracles, but through consistency. Your body was designed to heal. But healing requires cooperation. So today, I encourage you, not as a warning, but as a promise. Respect water. Use it wisely. Let it work quietly in your favor. I am Dr. Nnamdi. And your prostate health is not a mystery. It is a conversation your body has been trying to start for years.